everyone. Dr. Abhinav here from GMC Jammu MD Medicine. Here I am talking about a few updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to coronary vascular disease, which affects 45% people in the 14 to 16 age group. And raised blood pressure is among the most important risk factors for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow up. In India, the prevalence has also gone up to 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. And International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource poor settings. Optimal care refers to evidence-based standards of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource setting. And AHN ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adult where no ASVD or 10-year CVD risk less than 10% with stage 1 hypertension where blood pressure is 130 to 39 and diastolic is 80 to 89. Management starts with the non-pharmacological therapy if blood pressure remains uncontrolled at 3 to 6 months, considering starting pharmacological therapy. And acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate with severe COVID-19. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in the people with COVID-19 induced ARDS. So, lowering blood pressure targets down to the 110 to less than 130 millimeters of mercury range substantially reduce cardiovascular adverse event in the STEP randomized trial, affirming the sprint findings for an older, Chinese population. Among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of the composite severe risk, and findings from a now second major trial supporting a lower target could unite the guidelines, which even among the US professional societies range from threshold of 130 to 150 millimeters of mercury. And most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 28 European guidelines equally recommended 5 classes of antihypertensive drugs, considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitors or ARB plus you can add CCB or diuretic. Since early July 2018, products containing valsartan have recalled worldwide. The reason is the detection of known carcinogen, namely NDMA, that is N-nitro-dimethylamine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. So NDMA has been classified by WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patients would have been received NDMA contained valsartan from Zhejiang, Huai manufacturing site where the high level of contaminants were found every day for 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8% of additional cancers in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits of plus 6%. Thank you.